Hi, my name's Ann Bynum. I'm a board-certified pediatric dentist, and I live in Greenville, South Carolina, and I perform tongue ties and lip ties on lots of patients. I think the word that comes to mind when I think about using a light scalpel laser is it was a game changer. It was a game changer for me as the provider and also for my patients and my families. And I was stuck on the price tag for way too long, and I wish I would have jumped in a lot sooner. I bought my light scalpel in 2017, and I was using a diode prior to that. But what I now know is that I could have had better results because my patients now, and I wish there could have been a study that I would have done just in my own little petri dish, because I feel like my patients, as soon as I'm done with a procedure, the crying is over. Whereas before there was a lot of what I would call a discomfort cry, and I don't have that anymore with my light scalpel.
You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Hello, everyone, and welcome back to this week's episode of the Tongue Tie Experts podcast. I'm your host, Lisa Paladino, and today I want to share with you a very special story. I had a patient come to me that she just touches my heart. She is just a really special woman and very motivated, and she has been through it. And because this week we had some, like a breakthrough, I'll say, I wanted to just explain to you how, in my experience as an expert, as an experienced nurse, lactation consultant, midwife, someone with extensive lactation and tongue tie training in oral restriction treatment, and training in functional medicine. This is my approach to the family and how we are going to assess, refer, and treat a complex case, right? So I have her permission to share, but I'm still going to change some of the details to protect her privacy. Her name is different. So if you're listening and you think this is you and the names sound different, I'm not going to use your name, but I will tell you a story, and I will tell you how it feels to be able to have supported, to have an impact on a family when they feel there is no one to support them. So we're going to rewind back about 8 years. I met Patty with her first son, Jonathan. And Patty and Jonathan had been struggling to breastfeed. Before Patty had Jonathan, she had some health issues. She's got autoimmune disease. She's a little bit overweight. She had some insulin resistance. Her blood pressure was up and down. She had a decent pregnancy. She had a vaginal delivery. She had the baby, and he was not latching. He was very difficult to latch on, and nobody could give her a reason. And she was being advised just to pump and give her milk, or just to give formula. And that did not feel right to me. So she Googled lactation consultants, and I came up, and she came to see me. And, I've seen hundreds, if not thousands of families in my career, probably thousands. But some of them, I mean, if you're in this field, you'll know some of them, they just touch your heart, right? So here was this woman from another country, no family here to support her, knowing that this was the way she wanted to feed her baby. So motivated, so strong, putting her healthcare needs to the back burner, which I don't always recommend. But in this case, it was like, I don't care what I have to do. I want to breastfeed this baby. Help me, Lisa. And I'm not going to go into the story of that baby today. But let me just say, she wound up having a very successful breastfeeding relationship. I think that baby nursed, or that child nursed, until he was 4. He's a very healthy 8-year-old now. And we stayed in touch, and, Christmas cards and things like that. And she would reach out and every once in a while thank me, which is so heartwarming, right? Thank you, thank you, thank you. I couldn't have been here without you. And that really makes me feel good. And that's the kind of thing that keeps us going. So fast forward about a year ago, I heard from her, and she told me that she had had multiple miscarriages and multiple failed IUIs, and she finally was pregnant. She had IVF. This was her last chance. She's 40 years old, and she's pregnant. She really wanted to have another baby. And here she was after all of this. Long medical history. And why is that important? It's very important as an IBCLC or any healthcare provider to look at the maternal history for risk factors, for oversupply, for undersupply, for postpartum depression, for all the things. You are in charge of looking at the whole picture and saying, not in charge, responsible for is a better word. You are responsible for knowing what the health factors are on the maternal side so that you can be aware and support and give realistic expectations, right? So Patty came to me. We had a visit when she was 34 weeks pregnant because of her complicated health history. The baby wasn't growing. They were diagnosing the baby with intrauterine growth restriction, which is IUGR, shortened, right? And the baby was, I think, 34 weeks, and they said he just was not growing, and they were very concerned for the baby. And they were talking about possibly inducing her the next week. She did not want to have a preterm baby, but her number one concern was, if I do have a preterm baby, what should I expect? She said, Lisa, I want, and this was her in her intake form, her reason for visit was to know how to breastfeed a preterm, small NICU baby. What should I do? This was ideal, right? There's no other way to say it, that she came to me to prepare. And prepare we did. Because I'm a midwife, not only did I, help her get ready for breastfeeding, but I also gave her hints to help her nutritionally, rest-wise, what she should be, her intake should be, what other things, some supplements she could take to make sure that the baby was getting as much as he could and that her blood pressure would stay down and the baby would continue to grow. So baby Michael stayed, he gestated until, she came to me in June, and he was born on June 28th at 36 weeks. So we held her off for 2 weeks. And she called me. She was all upset. He was only 4 pounds, 3 ounces, which for an IUGR baby who, hadn't grown, this was an improvement. And they would not let her breastfeed She was pumping, so that's what I prepared her with. You start pumping right away. We did some prenatal milk expression. She had colostrum frozen. She gave that to them. The baby got her colostrum. After 2 days, she found out that they were giving the baby breast milk fortifier without asking her, which really upset her. I supported her through it, and I said, you know what, Patty, just do what you can to get him home, and we will take care of it. So she comes home, first time latching, baby latches right on, right? No pain, sucking and swallowing, things are going well. So that was, I think, day 5. At day 7, they came to me. She said, Lisa, I just want to make sure I'm doing everything I can. So when I saw baby Michael at a week old, he was already gaining weight. He was up to, let me put on my glasses to see this. He was up to 5.5 ounces and his birth weight was 4.3. So that's pretty amazing. At this time, he was making tons of wet diapers, at least 8. He was having 5 bowel movements. They were a little dark, but they were yellow. And in the office, he transferred 1.3 ounces, which is like pretty incredible, for this little guy. He was small but mighty. Now, of course, mom had issues too. So this is the holistic part of it. Mom had a C-section. She had a wound infection. Due to her history of autoimmune and insulin resistance, she has a problem with healing. And she had a wound infection that remained open with a drain. She was on 2 different antibiotics. She was swollen from the birth, like edema, holding water. But her milk was in, and she was thrilled to finally have this little baby home. Now, when I examined the baby, did he have a tongue tie? Of course he did. He had what I would describe as a mid restriction. Wasn't quite posterior, wasn't quite anterior. He didn't have a lot of lift to his tongue. He could not elevate it. He could not lateralize, but he was transferring milk and mom had no pain. Now, in my office, I use Dr. Rajiv Agarwal's FLIP tool. It's a validated tool to diagnose breastfeeding dysfunction. So I had Patty fill out the FLIP tool. Now, if you want to find the FLIP tool, and for the podcast, I'll put it in the show notes, you could just Google validated tool to diagnose breastfeeding dysfunction. It's a very good tool, not to analyze breastfeeding, but not to analyze for tongue tie, but to evaluate breastfeeding dysfunction in general. And it's something the parent fills out. So it's their experience, right? Which I love. So if you are looking for tools in the Professional's Guide to Tongue Tie and the Breastfeeding Infant, I have an entire section reviewing different tools that are used for assessment of tongue tie and breastfeeding. So if you're interested in that, that's part of the reason why there's more SERPs now for the course, because I did that whole section, and also a section on, we have a section now on scope of practice. So important, right? So the first time we did this tool, her rating was, her latch score was 8 and her total was 29. So that when you look up the scale with a latch score of less than 9 and a total score of 28, we want to say no intervention at this point, just breastfeeding dysfunction prediction is 55%. So it's half and half. She may be okay, but some people, including me a few years ago, might have seen this baby and said, okay, there's definitely a tongue tie. There's definitely a lip tie. Everything is going okay right now, but I know it's going to be a problem because this baby can't lift his tongue. And the only reason he was transferring milk is because Patty had an excellent milk supply, right? So our milk supply work before and at her birth facilitated this baby gaining faster than the rate we expected him to, right? So he was good that way. Could I have sent her then for tongue tie release or tongue tie evaluation? I could have. However, this is the holistic part. First of all, she was traumatized. She was completely traumatized, her and her husband, from the experience having an emergency C-section, having the wound infection, having the baby in NICU for 5 days, all of that while trying to navigate their 8-year-old son, right? So where was this family? How could I add more trauma to the family? So what do I do at this point? I educate. I tell her, listen, Patty, here's what's going on. He's doing great now. Will he probably need a tongue tie release at some point? Probably. But right now he doesn't. So let's heal you. Let's keep your milk supply going. And I gave her ways to do that to ensure. I gave her warning signs. And we said, let's stay in touch. So
I went to the pediatric frenectomy course twice. And it was at one of the infant frenectomy courses that I realized, there's no way I'm not going to be able to get this laser. It's just wonderful. I'm Dr. Michael Eisman, pediatric dentist in Wichita, Kansas. I've had my light scalpel for almost a year now. I actually purchased a Solea laser before I purchased the light scalpel. And I can tell you that while they're both great lasers, I think the light scalpel is very user-friendly, and because it's so much more lightweight and easier to fit into the small mouths, especially the infants, it's my preferred tool, especially for frenectomies. Patient care has been wonderful, both intraoperative as well as postoperative. Discomfort levels are very manageable, decreased from what they could be from other tools. Just about everything I do with the laser I wasn't doing before.
So she came for another visit at 17 days old. He was 17 ounces above his birth weight. Now, those of you who know this is amazing. We don't expect a baby to get to birth weight until 2 weeks old. This baby was only 3 days past that, and he was 17 ounces above his birth weight. He had gained a pound in 10 days. So he was doing okay. Now, again, I went through the list. Is he spitting up? Is he causing pain? Is he gagging? All the things. Her only symptom that she complained about was she was nursing him almost constantly, and he seemed gassy to her. So we worked on, a little bit of making a routine there. I gave her some advice, about being able to get some rest in between. I won't go into that here, but he transferred 2.3 ounces. That's how amazing her milk supply was. And he was handling it. No reflux. So I was happy. But again, I said to her, Patty, we know there's a tongue tie there. So the moment it starts hurting or the moment it's hard, let me know. And when you heal, let me know. And then we'll talk about next steps. So about a week ago, little over a week ago, I got a frantic call from her. And she's like, Lisa, I have to come in. Michael will not even latch. All of a sudden, he does not want to eat. Yesterday was a little bumpy, but today he won't eat at all. I said, all right, good thing she lives in my neighborhood. And I want to add, I don't think I said this. I don't just say, okay, we're not dealing with the tongue tie. I gave her referrals to go see any one of the body workers that are in my network. I have a chiropractor locally. I have a great 2 different craniosacral therapists. I have a craniosacral therapist who's also an occupational therapist who does therapeutic tummy time. If there's a physical therapist, I recommend. So I gave her that list and I said, little Michael has had a lot of trauma. He's a little tense. He had a little bit of torticollis from my point of view. Let's get that worked on before we think about having the procedure. So it's not like I ignored it. We started treatment. I know this is complicated and I go in different directions, but I want you to know that before I talk about what happened about a week and a half ago. So she called me saying, I'm frantic. I don't know what to do. So I said, all right, you know what? Come on over. We were both fortunate. I was free. She came over and he was very upset, little Michael, and we did things to calm him down. We did some skin to skin. I could not get him to transfer milk. I wound up showing her, different ways to supplement him, and she had already pumped and bottle fed. So we fed the baby and we talked about plans. But in the meantime, his weight gain in the past month from that visit had been 37 ounces. So he was doing really well. He was up to 7 pounds, 10 ounces, but he was very gassy, and she was feeding him constantly or trying to feed him constantly. Never felt like he had a good feeding. Still no pain, but we did this score again. Okay, so the score again, if you didn't hear me before, it's the FLIP validated tool to diagnose breastfeeding dysfunction, and it's available. You just Google that. It's Dr. Rajiv Agarwal made this with his team. It's a great tool. So her latch score went from 8 to 20, and her total score went from 29 to 41. So I felt like, okay, now, Patty, it's time to consider release. Have you had the body work? And she said, Lisa, honestly, I wanted to go to the chiropractor, but I've been so overwhelmed with my own healing. I haven't. So we talked about ways to keep her milk supply up, get the baby fed, and get ready for tongue tie release. She had a visit with the chiropractor. I think it was her second visit. And they made the plan. And yesterday, baby Michael had his release of tongue and lip tie with Dr. Siegel in New York City. And she sent me, and I'm going to tear up saying this because she sent me a note. She said, Lisa, Michael hasn't been latching, but as soon as the procedure was over, we went into a private room and he latched, and it felt different than it's ever felt. And I feel like he had a real feeding, and I'm so glad we did this. So, yes, he is. I was just thrilled. Not for me, but for her. And here is, this is just one story of hundreds of stories. The moral of this story is not just, okay, we had a good result, but it's the guidance along the way. So it's a journey, and we can't just consider under the tongue. We have to consider the whole family, the whole dyad, right? We have to consider it all. And in this case, we did. And, there was more to the story, and there will be more to the story. Last night, he was having trouble latching again, and I talked her through it and gave her different ways to cope. All of these things are in my parents' guide for parents, and also in my professionals' guide. I teach you the steps and what I actually tell the parents, and the education materials that we have ready to share. But the reason I wanted to tell you this story is because, sometimes I just do what I do, and I don't stop to think about the impact that I'm having. And I'm sure that's true for a lot of you who are professionals in my audience. And I want you to take a moment and realize how important the work you do is, the impact you're having on families, and have the support that you need, right? So make sure you have support. If you're in my groups, we're here for you. Reach out with the good stories. Reach out with the sad stories. We're here. This was not an easy story, and it's a continuing journey. If you're a parent, it's important for you to hear this and to know that if somebody is telling you, oh, just go get that tongue tie released without a full evaluation and assessment of what's going on for you and your baby and your family, then you're not getting holistic care, and you deserve it. So thanks for listening to my story. Thank you for all the work you do in the world. And I hope that we will hear from each other again soon. Take care.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye.
I am extremely happy with my carbon dioxide laser, my light scalpel. Hi, my name is Rajiv Agarwal. I'm a pediatrician, and I practice in Phoenix, Arizona, and I do a lot of frenectomies. My patients are very happy. The one thing I have noticed clinically is the number of days of pain has probably gone down by about a day. When you're talking of a newborn, the number of days of pain is 3 or 4, maybe 5, and it goes down by a day. It may not seem very significant, but it is very significant. It may be 20% or 30% lesser number of days of pain. And that has kind of made me very comfortable with the choice that I've made. I have trained a lot of people who have gone through my office, coming to see, hey, should we buy this, not buy this? My strong recommendation has been, do it, because you don't know what you don't know. And when you know it, you don't look back and you say, what was I thinking?
Visit lightscalpel.com to learn more.